Alrighty, Kelly, floor is yours.
Okay, I'm just trying to find my share the actual PowerPoint here.
You want to use the bar on the bottom. It has like that share feature.
Yeah. Oh, I found it. Okay.
Looks great.
Okay. So if you are not aware, Peninsula Community Health Center, uh, Peninsula Community Health Services is a federally qualified health center. We provide access to quality health care. We believe it should be available to everybody. So that's why we strive to make our services accessible to everyone, not just in Kitsap, but Mason and rural Pierce County. We accept most major insurance plans, including Medicaid, Medicare, and TRICARE. So we also offer a sliding fee scale for people that don't have insurance, so they can get the care that they need. There we go. So our insurance navigators, we offer the service to the community regardless of their status with PCHS. Not everybody knows this, but they don't have to come here for any services. Literally just anybody that's living in any of those 3 counties that needs help with insurance. We are the lead organization in Kitsap County. So that just means like we can help anybody. We have 2 enhanced users. We also have, well, I'll get there. So that process looks like people can just call in to our phone number or just pop into a clinic and schedule an appointment with a navigator. Most of them are in person, but they can definitely schedule appointments where they just give them a phone call. So what that looks like is they just come in, meet with the navigator. They bring any documents that they have, so like proof of income, medication lists, different things like that. And so the navigators will check and see if they have an account, whether Washington Health Plan Finder or Medicare, if you know they're on Medicare or needing that. So the navigators are amazing. They can troubleshoot with the patients and follow up with them whenever it's needed. So our navigators are absolutely amazing. They provide really good patient-centered care. They really build good relationships with the clients. So they'll ask them screening questions, household income, health issues, medication lists, various things. And then the patients can email documents if they're unable to bring it in person. They make it really user-friendly for everybody. So, and we serve a lot of underserved people, homeless population, just anybody and everybody. So all of our navigators are really trauma-informed care and patient-centered care. They're absolutely amazing. Anybody can refer patients to PCHS for this literally at any time. There's no, there is like open enrollment with health insurance, but we can meet with anybody at any time and answer their questions. So our navigators are also SHEPA certified, so they can help them sign up for Medicaid, just qualified health plans, Medicare, anything. So they can see them for follow-ups or if they have any issues or questions about their insurance. So, and like I said, this is for Kitsap, Pierce, and Mason. And just, any guidance in general is that anyone can sign up for Medicaid, Medicare, or qualified health plans at PCHS. That doesn't mean that they're always eligible, but, we will meet with anyone, and they're amazing. Our navigators will find what they are eligible for and help them navigate that. So they can provide education and instruction to people about when they can sign up and if they're eligible or if they qualify for a special enrollment period. Obviously, there's lots of changes rolling out. So House Resolution 1 that was signed on July 4th, there's lots of provisions that impact Apple Health. eligibility, including non-citizen coverage. So people these will not affect. These changes will not affect as children age 18 and under, pregnant persons, emergency services, or the Apple Health expansion. And programs that are not impacted. So this would be Apple Health for pregnant individuals, after pregnancy coverage, Apple Health for kids, emergency medical, Apple Health expansion, family planning only, medical care services, refugee medical assistance, foster care or adoption support, and long-term services and supports for non-citizens. And then the non-U.S. citizen, there's been a definition change. So lawfully permanent residents are eligible for Apple Health if they've met the 5-year bar or they're exempt from meeting it. And the 5-year bar is a federal law that requires many qualified immigrants to wait 5 years before becoming eligible for federal Apple Health coverage, unless their initial status exempts them from the 5-year bar. And then the following non-citizens will remain eligible for federally funded Medicaid coverage. Lawfully permanent residents, so they have their green card and they must meet the 5-year waiting period. Any Cuban or Haitian entrants, any compact of free association islanders. And then, yeah, lawfully, a lot of this, just so you know, we're not going to know until it all rolls out, and that's kind of been going exactly the extent of how all of these changes are going to play out, but this is just all the information that we've been given. So, let's see here. And this is individuals over 100% of the federal poverty level may be eligible for a qualified health plan with tax credits and Cascade Care savings. Individuals below 100% federal poverty level may be eligible for a qualified health plan with Cascade Care savings. And then beginning January 1st of 2027, subsidy options transition to Cascade Care savings only for non-citizens that do not qualify for tax credits and have income up to 250% of the federal poverty level. So, and then so starting, and it's a lot of information, starting October 1st, lawfully present non-citizen changes are, there's just some changes to the eligibility for refugees, asylees, and other non-citizen adults. And then all starting on January 1st, to remain eligible, people enrolled in Apple Health for adults will be required to work, train, or do community engagement 80 hours per month, and there are some exceptions. Also, instead of renewing coverage every 12 months, it's going to be every 6 months for adults. And then retroactive coverage will be shortened from 3 months to 1 month for Apple Health for adults and shortened to 2 months for all other Apple Health programs. This is just kind of a little map I put in there of people that are covered by Washington Health Plan Finder by county that are under 65 years old. This isn't Medicare, this is Washington Health Plan Finder, so it's Medicaid. And I do believe that Olympic Connect is Clallam, Jefferson, and then Kitsap's a little lower with 22%. And we also cover Mason and Pierce. All right, and then just a tip on how to avoid a gap in coverage for our people. So customers who are losing coverage due to their immigration status should have or going to receive an updated eligibility results notice in the mail in mid-late August explaining that their Apple Health is ending after September 30th, 2026. So they will have 60 days from the date on their eligibility results notice to select a 2026 qualified health plan. So coverage for plans selected at any time during that 60-day special enrollment period will begin October 1st of 2026. And then I just have some success stories. I think this one was from Kat. She said a young woman was seen at one of our Bremerton clinics that was receiving a substantial amount of money from Medicare disability. She didn't qualify for Medicare savings because of a large sum of money that was in her account, even though it didn't belong to her. It was for a family member. So Kat helped facilitate the patient's parent bringing in a letter stating who the money was for, and that patient was able to receive back pay from Medicare savings, which was amazing. And this is a story from Jolynn. She had a gentleman come in with his wife and 4 children. He had hoped to renew his children's coverage with Apple Health, and his wife was pregnant. So he was worried about her coverage as well. And after speaking to them for a while and learning that they were immigrants, and that he'd been in the country for more than 5 years and had his green card, he was able to apply for insurance for himself. So he was focused on his family, it looks like. So she said, I asked if he'd like to apply and reminding him that if he was offered a plan that was too expensive, he could decline. And that's the nice part is, you know, they can just let them know what all their options are. They don't have to agree that day. So she added him to the application, and the children were renewed. His wife was approved for Apple Health for pregnancy, and he was also approved for Apple Health for adults. And it looks like it was just a really awesome story there. So, and then I can put this in the chat too, but if you have any questions like in the future, or you're just out there like, because things are changing all the time. You can always email our entire Navigator team at eligibility@pchsweb.org.
Kelly, that was awesome. I'm curious, does
Yeah.
anyone have any questions for Kelly? Oh, what was the eligibility email again? Do you want to Slack that?
Um,
Or not Slack that, sorry, wrong program. Do you want to add that to the chat?
yeah, I can do that. Oh my goodness, I am just like having issues with my Zoom right now.
That's
But yeah, I'll
okay.
put it in there for them.
Oh, Jolyn did
Got
it
it,
for you.
Kelly.
Oh, thanks, Jolene.
You're welcome.
Sarah, I see you off mute. Did you have a question?
So sorry. No, I thought I was muted.
Oh, it's okay. I was not trying to call you out. I'm sorry. We've got a
Oh,
question
good.
in the chat for you, Kelly. So Corey said this may have been explained already. I have sort of been in and out. Can someone just walk in and inquire about getting help with insurance, or do they need an appointment?
They can certainly walk in, but I would say our navigators are extremely busy. Sometimes it's just back to back to back to back, but it's always okay to walk in and ask. It's always okay. And if they have availability that day, they will definitely see them. It's just not guaranteed. And sometimes it can be quicker to walk in versus calling because our wait times for phone calls can sometimes be a little lengthy. So
You can also use your website, like the chat feature, to get scheduled too, as well, correct?
I believe so. I'm not super familiar with that.
Yes.
We are at most clinics. Yeah. Is it every clinic, Jolynn?
We're not at all clinics right now. We have spread out. We do have a Medicare and Apple Health Navigator at our Bainbridge clinic now. It's one of our newer clinics. And in Powder Hill, we are in Silverdale, Bremerton, Belfair, Port Orchard, and Key Peninsula right now. So we hit basically all the counties there, but we're the lead org only for Kitsap County at this time.
And a question that I have, because we have some folks that like might support Jefferson County, like even if folks don't necessarily live in Kitsap, they could, if you were like the nearest navigator, they could come to like your Paulsville clinic and get support, correct? They don't have to live in Kitsap.
Absolutely.
Okay.
Yeah. And if they call, we can also connect them with a local navigator if it's more convenient for them. I've had someone call me from Mount Vernon that I've worked with a bit, and she somehow got connected to me. We've talked a few times, and I was able to connect her with someone up in her area.
Fabulous. So you guys are like a great starting point and you can direct them to like what makes sense. That super helpful.
Exactly. And I also noticed in the chat, yes, any clinic, they can walk in and make an appointment and talk to them because all of our clinics schedule for all of our clinics.
Awesome. Any other questions for the PCHS team? I'm taking silence as your presentation was really awesome, Kelly.
Good job,
So
Kelly.
high five to you. Awesome. Well, I want to thank everyone for attending. Recording's going to be added to our YouTube channel, and then you guys will hear the Olympic Connect folks. You all will hear updates on how to access this later. I'm going to share that out with you next week, but there will be an easier way to access recordings that will not be in Genius anymore. So more to come for that. Excited to hear from the PCHS team. Really appreciate y'all, and we'll see you all next
Perfect.
training. Thanks, everyone.
Good to see you, Yvonne.
Thank
Take
you.
care. Thank you.
Bye.